move to Mr. Jim Campbell, the Director of the Health Workforce Department in the World Health Organization, which supports countries in achieving national and international goals to strengthen their health workforce. The department's work includes the State of the World's Nursing Report and the WHO Global Strategy on Human Resources for Health. Mr. Campbell, healthcare systems can only function with a strong, agile, and motivated workforce. Yet, according to the WHO, before the pandemic, the world was short of 18 million health workers to meet the globally agreed health targets of the Sustainable Development Goals by 2030. The COVID-19 pandemic has sent shockwaves to health systems globally, with the phrase flattening the curve now in common vernacular everywhere. An attempt to ease the burden on an already strained health facilities, and in doing so, help save lives. Mr. Campbell, what needs to be done to manage the pandemic and enhance capacity so that we can better tackle crises in the future and to stay on track to meet the SDGs?
Madam Chair, good morning, good afternoon, good evening. Thank you very much, and my congratulations to the co-hosts, and thank you very much for the opportunity to speak today from Geneva. Two parts of your question there. Let me deal with the first one on the pandemic. And the honourable ministers from the Republican Korea, from Kerala state in India, have given us two excellent examples of how to manage the pandemic. And there's a number of factors which we're seeing across jurisdictions, which are indeed very common themes that are emerging in terms of having success in indeed, as you say, flattening the curve, this new language that we're all now familiar with. Firstly, I think there's an element of personal engagement in terms of the communities and the people, the population, to ensure that we invest in personal hygiene, in hand washing, and in following the guidance that's provided to us from the experts in government, from the public service, or from the evidence that the World Health Organization, the likes of the International Council of Nurses, are making available. So to make sure that we're following social distance. We're then seeing that governments and their leaders are very much driving the test, trace, and treat mandate of the response. Know what you are dealing with, know the incidents in your population, and ensure that you are being as responsive as possible. And we've seen innovation, as the minister, the honourable minister from Republic of Korea put forward there. How do you scale up your testing? How do you introduce drive-through testing? How do you use technologies to make that possible? The other element we're then seeing in terms of managing the pandemic is the global solidarity that the Director General, Dr. Tedros, spoke about in his keynote remarks. And this is the element of accelerating access to the COVID tools globally. And we're seeing that this is having a major impact in our approach. So we can accelerate both the potential of the vaccine, the diagnostics, the therapeutics, and to share that globally on an equitable basis. The other element, I think, that the president from Annette Kennedy mentioned in her remarks, the emphasis on personal protective equipment, infection prevention control that we heard from the country examples, to really address this at scale and to do it well, to ensure our public service workers, our health workers in the front lines, be they nurses, be they midwives, be they other clinicians, emergency workers, are enabled and protected to go about their works. We should all be saddened, but also shocked at the number of health worker infections around the world and the tragic loss of life. Let me turn then to the second part of your, how do we build back better? This phrase that we're now starting to hear. And again, I point to the Honorable Minister from Republic of Korea, who talked about how they are already introducing new public sector engagement, reducing contact interaction and using technology and tools there to take that forward. How can we build back better? You rightly talk about the shortage of 18 million healthcare workers that we've seen globally around the world. When we talk about the education sector, for them to achieve their ambitions in the Sustainable Development Goals, you're looking in the magnitude of maybe a shortage of 70 million teachers worldwide. And why are we short of our core public sector workers that we now realize are absolutely essential to such situations when we have a global pandemic, when children around the world, 90% of the students around the world, are no longer in school and are reliant upon new innovation. It is the impact of not investing in education and employment. And we need to take that action if we are to achieve our public policy goals. We have the representative, the Undersecretary General from the UNPSD with us today. And he has been with China and the SDG Fund, one of the first organizations to work with WHO to actually address this shortage in investing in education and employment in the health sector. We are working in a number of countries with UNPSD and China's support to address this phenomenon. We need to invest in human capital and social spending in the health, education, and social protection sectors. ICN, the International Council of Nurses, and your final speaker from Public Services International were part of a UN high-level commission on health sector employment and economic growth. The evidence is absolutely clear, crystal clear, on the investments we need to be making. We need to connect in the skills and the competencies of the future workforce. We need to ensure people are provided decent work. We need to aspire to equitable distribution of that workforce to respond to population needs. Sometimes a pandemic will teach us many things. Sometimes an epidemic and a global response to it will give us new lessons. But at this moment in time, we should also look to the existing evidence and the existing lessons to actually say part of this response is for the political will, the political leadership to invest in a public service and a public sector that is fit for the ambitions of the Sustainable Development Goals and for health, for the ambition of universal health coverage. Madam Chair, thank you very much, and a happy UN Public Service Day to all listeners and speakers.